Okay, so the first argument that we're going to consider is the argument that says, well, at least sometimes active euthanasia is actually more humane than passive euthanasia. Might seem counterintuitive. Why would it be the case that killing might be more humane than letting someone die, than just simply letting nature take its course? Well, let's investigate this point. Why believe that active euthanasia can be more humane? So that's kind of the general question that we're going to be asking with regard to this first argument that Rachel's proposes. Now, Rachel's thinks that we can consider sort of a familiar case. The case that we have in mind here is where a patient is dying of some sort of incurable form of throat cancer. And I think it's important to keep in mind that the case that Rachel's is working with, at least initially here, is a medical case, right? Maybe there's some other cases that we might want to consider, but at least for our current purposes, let's just keep it within the realm of medicine. So this patient is dying of an incurable form of throat cancer, right? So the patient, let's suppose, is experiencing just extreme pain, just an extreme form of suffering. And let's say that the pain can no longer be alleviated, right? So got extreme suffering, and that suffering is not, we're not able to alleviate the suffering anymore. And we can also say that, let's suppose at least, that the patient is going to die. It's just the case that the patient is going to die soon, at least, maybe within the next few days or so. And let's also suppose that the patient does not want to continue to suffer these few days, right? That seems pretty intuitive, pretty plausible. Got an extreme amount of pain and suffering, can't be alleviated. You're going to die pretty soon, anyways. Patient does not want to suffer for those days. So the patient requests to die, right? This is what we're supposing. Now let's also suppose that the patient's family agrees with what the patient wants. Let's suppose that the patient's family joins in the request to die. And finally, the patient's doctor agrees, right? After considering all of the different options, a lot of reflection on the case, talking to the patient and to the family members, the loved ones, and so forth, the doctor agrees with the patient's request to die. So that's the kind of the familiar case that we're thinking of, this sort of medical case that Rachel's has in mind. But now let's change a certain element in this case. What would we say if the doctor says that passive euthanasia is morally permissible, but active euthanasia is not? So, in other words, if the patient requests to die, then the only way we can do this is through letting the patient die. We can't perform any kind of active euthanasia, right? In other words, the doctor can't prescribe some lethal dose. Now, it's interesting because we might want to keep in mind, what about in the case of certain drugs like morphine? You might think that in some cases, the morphine is actually a lethal dosage. There might be some wiggle room we might have to think about there. But nonetheless, the idea here is that the doctor's hands are tied. Doctor agrees, but it's just not the case that we can perform active euthanasia. We can only perform passive euthanasia. We can only let the patient die through natural causes. Well, one might ask, what could possibly be the justification for that? How would we go about offering reasons in support of the claim that we can let the patient die, but we can't kill the patient? That's kind of the idea here. Now, suppose that withholding the treatment and letting nature run its course, right? Suppose that performing passive euthanasia, it would just take much longer, maybe a few weeks, rather than administering lethal dosage in the case of active euthanasia. Now, suppose that since this would take longer, that would actually result in prolonged suffering. So we're going to be increasing the amount of suffering that the patient actually experiences. Suppose that there would be much more pain as a result of this choice to withhold the treatment, right? More suffering, more pain. Is that the sort of thing that as a medical professional we have an obligation to avoid? Is that the sort of obligation that we get from the do no harm principle, the principle of non-maleficence? I think it's something important to think about. Rachel seems to think that this would allow us to make the following kind of claim. Well, it seems as though in the case of active euthanasia, it would be more humane in this kind of situation. Why would it be more humane? Well, because you would be avoiding the kind of prolonged suffering, the prolonged pain that the patient would otherwise experience. You might even think in the case of something like a family pet, right? We don't want the family pet to experience that pain and that suffering. And so we put the pet down. We think that that would be the more humane thing to do, right? But why would it be more humane to put your pet down than it would be in the case of a patient like this? Looks like the non-maleficence principle is at work when we kill our family pet because we want our family pet to not experience that pain and that suffering. But with regard to our own family members, our loved ones, that seems like the non-maleficence principle should be playing a part there too. So Rachel just thinks that this is kind of a prima facie obvious point, right? That in a case like this, the active euthanasia would just be a more humane thing to do for our patients, certainly because it is with our pets. Why would it not be with regard to the patient as well? So what if active euthanasia was permissible, right? If it was permissible, isn't that what we would choose to do in a case like this? Wouldn't it be much more humane? Rachel thinks it would, right? And we might even want to say that it would be justified on consequentialist grounds. We want to maximize the good and avoid the bad. And it would be maybe justified on utilitarian grounds, right? We want to maximize happiness, well-being. We want to, minimize or avoid suffering, avoid pain. This seems to follow from the principle of non-maleficence. You might also think that it's a part of a patient's autonomy, a part of a patient's right or ability to do what they want, their self-determination. So if we were to not allow them to make that choice that kind of spirit of paternalism would be stepping in and violating the patient's right to make their choice, the right to self-determination. So it looks like it could be justified on consequentialist grounds, on utilitarian grounds, and even in terms of self-determination or a patient's right to express their autonomy. And there's another example that Rachel's discusses. So consider the following sort of case. Think about babies that are born with Down syndrome who go on to live a healthy life. Now consider that in some of these cases, these babies that are born with Down syndrome are also born with certain congenital defects of intestinal obstructions. And those sort of situations require operation in order for them to live. Well, sometimes the biological parents and the doctors will decide not to operate on these babies born with Down syndrome who have these defects, which will ultimately result in the baby dying. Why would the biological parents make a choice not to operate in a case like this? So a case like this is really rather interesting because although we would maybe be horrified by the fact that a parent would choose to do this, if such a choice was made, should we just allow the baby to die or should we actively euthanize the baby? Rachel's thinks a case like this would also show that active euthanasia would be far more humane than just simply letting the baby die. Of course, somebody will probably assert or try to argue that we must always operate on the baby in these sort of cases. Maybe we have a legal obligation, maybe there is a moral obligation. Someone might try to argue for that point, and that's fine. But suppose that the biological parents decided that they don't want to have a baby with Down syndrome. Suppose that it is legal. I don't think that it's legal in this country, but I know that the Supreme Court just actually ruled that they are not going to take this case up. So that sort of legal question is still kind of in limbo at this point. It certainly is legal in other countries. And so let's just let's just hypothetically think about this case. The parents don't want to have a baby with Down syndrome, and so they choose to not perform the operation. Notice that we're not here making any actual claims regarding the morality of that choice, right? We can even assume that the parents would be like really horrible people. You might think that these parents are going to hell. They're just like ridiculously moral monsters, whatever. None of that really matters. Even if we disagree with that choice, if the choice is going to be made, we can consider how the baby in this sort of situation is going to die. Well, how would the baby die in this case? According to the conventional doctrine that says that active euthanasia is never permissible, but passive euthanasia sometimes is. In other words, we might be able to let the baby die of natural causes, but we can never kill the baby. If active euthanasia, then the baby will die quickly with very little suffering. On the other hand, if active euthanasia is ruled out, if passive euthanasia is the only option available, then the baby will die of natural causes as a result of not performing the operation. What does that mean, though? Well, typically the following would occur to the baby. It would die of dehydration, most likely. It would die of some sort of infection. Sometimes it would take several days of suffering for the baby to die. And presumably the baby would die alone. Now, again, on utilitarian grounds or consequentialist grounds, this does not seem to be the morally right thing to do, right? And again, the principle of non maleficence, the do no harm principle, tells us we should avoid this sort of situation. So, passive euthanasia would not be the right option here. Active euthanasia would be in order to avoid these harms. And again, we're trying to imagine this situation insofar as we're setting aside the morality of killing a baby because it has Down syndrome, on the assumption that presumably we live in some country where this does take place. Well, wouldn't active euthanasia be the better option in that situation? This is why I think Rachel's is using this example, because it really does kind of get at our intuitions on this point. And so there's lots of other examples that we might think about, that we might be worried about, but Rachel's takes these two cases to illustrate, to demonstrate that there's just a kind of prima facie obviousness that, at least in some cases, active euthanasia would be more humane than passive euthanasia. And the next argument, we're going to look at the case of the Down syndrome baby in a little more detail. Maybe this might help kind of clear up some of the points that were made with regard to this first argument. And so that's what we'll address in the next lecture.